Hello and welcome to another edition of Another Book Review. This week I'll be reviewing Sick Money by Billy Kenber. I'll talk very briefly about the author, go into an overview of what the book is about, talk about what I liked about it, what I didn't like about it, who I'd recommend the book to, and finish off with what I'll be reading for next time. Billy Kenber is an investigative journalist in London. He's also done some work for the New York Times. This book is a full book-length look at the global pharmaceutical industry and how their practices over the last roughly 20 years, really even going back further than that, but focused mostly on the last 20 years, have caused healthcare costs to rise, not only in the United States but around the world. He looks at some really egregious examples of the industry of bad actors like Martin Shkreli, as well as the history of a company called Concordia. He goes into the history of drug manufacturing, I'd say from World War II onward. He stops and spends a lot of time on ADT, which was an HIV/AIDS drugs. I think HIV is a drug designed to fight HIV/AIDS, and he spends a lot of time there, I think, because it's, I think, one of the first times that the price of drugs really entered the public consciousness in a bad way. Talks about really the move in the 80s and the 90s towards what we call a superstar model, which was similar in some ways to what we talked about in the Rockonomics, which I think comes from Richard Florida. I'll leave the Rockonomics link below if anybody wants to see that video, but the idea that there's consolidation in the industry, and that because you had the consolidation, you had individuals who previously weren't involved in the pharmaceutical company who were really looking more to make returns on their money than they were in the pharmaceutical industry for any kind of philanthropic or utilitarian reason. So they were really looking to make their money back. And when you have that, I think that the idea was that everybody kind of wanted a superstar drug to go along with the consolidation. So everybody was looking for the superstar drug that was going to throw off all this money. And when those have become more and more rare to find, there was a move really towards marketing and competing on marketing and not competing on price, as the portfolios have kind of shrunk and you have kind of fewer and fewer cash cows. The industry has really resorted to competing on marketing while keeping their prices relatively high. He goes into what certain companies have done as far as patent law. Companies are issued a patent when they, I think it's a 20-year patent from a file, and usually that filing happens before the testing. And so a company may have 10 years exclusivity on the market. It may have 8 years exclusivity on the market. It really depends on how quickly it can go through these trials. But he goes through and explains tactics that companies use to extend the life of the patent, what he calls patent thicket, or basically putting walls behind the patent to try to make it harder and harder for generics to enter the market, even to the point where some companies have paid generic companies not to enter the market in an effort to continue to have elevated pricing. So I thought just a really fascinating look at the industry and really in depth, and I thought it was very thorough and covers the UK market and the US market and the world market. So I really did enjoy it. I thought that maybe the most interesting part of it was the part where he talks about, goes into a long discussion about the R&D budgets and what he calls Eroom's Law. That's EROOMS is a gentleman's name who I think has shown that over the last, I don't know what the period of time is, but let's just call it 40 years, for every $1 billion of R&D spent, it seems that there are fewer and fewer drugs that are being patented. And it's basically showing that these drugs are becoming harder and harder to produce, even though some of the input costs, like the computers have made certain inputs very, very much less expensive. And the reason for that are varied, but one of the things he points out is the possibility that because you have more of a market-driven culture, you have less and less of scientists sitting in a room working to discover things really based on their own scientific creativity, and more of really these like market-driven directives. And so there's this theory that kind of the apple orchard has been picked over, and that if you tell people that they can only work on cancer drugs or what are called orphan drugs due to market reasons, because cancer is such a huge market, you can charge extraordinarily high prices even for a relatively minor tweak that may improve someone's life for a couple months, especially in the United States, where there's this idea that, there's almost no value that you can put on life. And so extending life. And so there's this idea that you can charge really these exorbitant prices on cancer drugs because the market will bear it. And then orphan drugs, which is a drug where the pool of patients is relatively small. And so because of that, there's certain phases of the drug trials that the companies do not have to do on the front end. And on the back end, they're able to charge, I think the record is $2 million for a cure of a relatively rare disease. And so that's why he kind of goes through why there's been such a shift towards orphan drugs and cancer drugs, and maybe away from drugs that have larger groups. He also points out, the difference between diabetes and malaria in spending is like 10 to 1, and he kind of goes through why America really drives a lot of the market, and so a lot of the diseases that people have here, as far as people who can afford the medicine to pay for these diseases, why you have things like cancer, which is something typically associated with older people, why the focus is on those drugs of maybe upper middle class people from America, and not other drugs that could benefit potentially a much larger population. So I thought it was a really, really fascinating look, and I thought the idea of us having reached peak drug, so to speak, was really, really interesting. And he does, to his credit, he goes through he does a pretty large set of what he calls solutions to the problem. How many of them felt real feasible to me, I'm not quite sure. I think it's going to be very, very difficult to decouple or to ask people who have invested sometimes, millions of dollars, or pension funds oftentimes will invest in these drug companies, that they're just going to receive less money because there needs to be changes in the market, because drug prices really need to start coming down. But he does just basically note, he said basically that the path we're on is unsustainable, and so something has to change. And so it's a question of, is legislation going to be introduced? Are the companies going to, on their own volition, hit the brakes? It probably will not happen. But he also goes through what he sees as some pretty basic things they can do, like allowing Medicare the opportunity to bargain for drug pricing, which I think they're banned from doing now. I believe the Veterans Association is allowed to, but the Medicare program is not, which I found surprising. I didn't quite understand why that was. But it was just really fascinating. Look, if you've ever been interested in the pharmaceutical industry and you wanted basically one book to kind of go into and explain, I don't want to call it the banditry, because it's not all banditry. I think there are a lot of people who are trying to do their best, but it's also one of those things where it's hard to look at some of these examples and not cringe and wince and just say, that's basically, I don't know how else you can describe it other than price gouging. So I thought it a really interesting look. Sick Money. If there's some things I didn't like about it, it is a little long, and I think he probably could have cut the Concordia part out. He does, again, go into both the U.S. and the U.K. market, and there are certain differences in both of them. And so it is illustrative to see the difference between the U.S. and U.K. market. But I don't know if he could have maybe shortened those sections a little bit to kind of shave some pages. I think there's a couple typos in it, but if I was going to cut anything, it would probably be the Concordia section. And there's some parts that felt a little repetitive, and he kind of says things in a different way, but several different times. So Sick Money, Billy Kenber, I would highly recommend it if you are at all interested in learning about the pharmaceutical business, why it works the way it does, the perverse incentives that are just really, really rampant throughout the industry, and possible ways for us to change the system to make it a little bit less expensive for people. Really like it. Really, really thought it was really good. Reminded me a little bit of The Case for Mars, in the sense of just someone who does a really, really deep dive in one topic, and I thought it was really a good read. Next time I will be finishing 100 Years of Solitude, and for anybody who's waiting for the video, I apologize. I've been out a little bit, but I will about halfway done now. I will either be reading that or There's Nothing for You Here by Fiona Hill. I may finish this first because this is taking me a little bit longer than I thought it would be. But until next time, if you like the video, please subscribe to the channel if you haven't already. Please feel free to like the video. I'll leave my link to my Twitter below, and I'll also leave a link to both the Rockonomics and A Case for Mars in case you're interested in either one of those videos. Until next time, bye.